Hello and welcome to another intensive care at home and intensive care hotline emergency Q&A for families in ICU and intensive care at home. Thank you so much for joining me on this live stream, and I also want to welcome our viewers that watch this on replay. So thank you so much for joining. Now, before we go into today's question, I can see there's already questions sitting in the chat pad. What makes me qualified to answer questions for families in intensive care and intensive care at home and host an emergency Q&A? Once again, my name is Patrick Hutzel from intensivecarehotline.com and intensivecareathome.com, and I am a critical care nurse by background. I have been working in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013. And we've been saving many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecarehotline.com. And you can also verify it on our podcast section at intensivecarehotline.com, where our clients have been interviewed and vouch, for the work that we are doing. With intensive care at home, we are sending our critical care nurses into the home, and we have been doing so since 2012. And with intensive care at home, we are currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We're sending our critical care nurses into the home, and we basically provide an intensive care bed in the community instead of in ICU. It's a genuine alternative to a long-term stay, predominantly for long-term ventilated adults and children, but also for patients on long-term ventilation, tracheostomy, BiPAP, CPAP ventilation without a tracheostomy, or if they only have a tracheostomy without ventilation, right? With intensive care at home in Australia, we are NDIS approved, TAC approved in Victoria, WorkSafe in Victoria, iCare in New South Wales, and NIISQ in Queensland, as well as the DVA all around the country. Our clients would have also received funding through departments of health, public hospitals, private health funds, etc. So please reach out to us. And if you're watching this and you're in the US or in the UK or in Canada wanting intensive care at home, I also encourage you to reach out to us at intensivecareathome.com. If you need help there, we can help you privately. Okay, so let's get right into the questions. Also, type 1 into the chat pad if you can hear me, or type 2 into the chat pad if you can't hear me. In the meantime, I'll read out your questions here. Also, if you want to talk to me directly here, you can use the StreamYard link that I'm just posting in there now. And you can type your questions into the chat pad. Okay, so I've got a question here from Elitham. I hope I'm pronouncing this correctly. Elitham, thank you for writing in your question. He or she says, my dad, 65 years of age, with history of hypertension, hyperlipidemia, and type 2 diabetes, had a witnessed heart attack and cardiac arrest at work on the 25th of June, and was found by a CPR certified co-worker. My dad was pulseless and no breathing. The CPR started within 5 minutes. The emergency services were called after 1 minute. He received 1 shock with the AED. Emergency services got to Dad 6 minutes later. He was in ventricular fibrillation, and they began advanced life support. 5 times shocks from the defibrillator. He went into pulseless electrical activity, PEA, 6 doses of epinephrine eventually got to return of spontaneous circulation. After about 30 minutes of CPR, brought to the emergency department, was charted to be semi-responsive by a doctor, had soft restraints placed and sedated with propofol for intubation. Propofol paused for TTM, but doctors changed their mind last minute. I need to actually work out what TTM means. I haven't heard that term. And the other thing you are saying is, but doctors changed their mind last minute. Just give me 1 second. I just need to find out what actually TTM stands for. Targeted temperature management. Sure, for hypothermia. Sure. But doctors changed their mind last minute. That's interesting because most of the time, for someone with an out-of-hospital arrest, you would be starting cooling therapy. So, no reason was given for pausing the TTM. He was moved to ICU. The doctor said 3 days later he would not wake up or make any meaningful recovery and do WLST, but he has been opening eyes and responding to our commands, blinking and moving feet. Okay. Yeah, and then I just need to find out what WLST means. I haven't heard that abbreviation before either. WLST. Oh, withdrawal of life support, sure. And do with withdrawal of life support, but he has been opening eyes and responding to our commands, blinking and moving. Okay, all right. Yeah, okay, well that's... So this happened on the 25th of June. Today is the 21st of July for me. For you, if you're in North America, it's still the 20th of July. So basically almost a month ago. I guess my question to you is, what's your dad doing right now? Is he still ventilated? Is he having seizures? You know, is he still opening his eyes? Has there been any improvement in terms of his neurology, in terms of his neurological condition, right? I assume you have not given approval to any withdrawal of treatment. Otherwise, you wouldn't be telling me about your dad's situation. So if he's blinking and moving and he's responding to you, what's the point in not continuing treatment? Also, you know, whilst the doctors are saying he won't wake up and make any meaningful recovery, well, you can now ask your dad what he wants. You know, even if he can only give you yes or no answers, you can ask him the right questions, whether he wants to continue, right? Whether he wants to have life support taken away. So I believe if your dad can communicate, that makes your decision making easier, you know. So, you know, what does meaningful recovery mean? What does it mean? It might mean something very different for you than it does mean for the intensive care team. Meaningful recovery for you might be, you can talk to your dad now. That's meaningful. That is recovery given where he started. Like I said, I have no judgment here one way or another, but whatever meaningful means to you may not be meaningful to me, and vice versa. And there's no judgment in there. It just is, you know. So I do believe your steps of what to do next are pretty clear. You ask your dad what he wants to do next. You know, if he doesn't have a or if he can't wean off the ventilator, right? Does he have a tracheostomy? If he's still ventilated but he doesn't have a tracheostomy, does he want one? Right? If he hasn't gone to neurology rehab, he probably needs to go to neurology rehab, right? But if he is moving his eyes and he's blinking and he's moving his feet to your instructions, that's a clear sign his brain is there, right? So, Alaitham, does that answer your questions? And if you want to, I encourage you to join me live here on the StreamYard link. You know, then we can talk about it, but you're also saying he's been opening eyes and responding to our commands, but he's still on the ventilator. The doctors are refusing to do the tracheostomy despite us asking for it. He has not had any seizures. Why are they refusing a tracheostomy? That's unheard of. Is he still sedated and on opiates? And why are they refusing the tracheostomy? What ventilator settings is he on? What's his Glasgow coma scale? He has no brain function. Well, clearly, that's unbelievable. That is unbelievable. Has he had a CT scan of the brain? Has he had an MRI scan of the brain? Has he had an EEG? Have you spoken to a neurologist? Right? That is what is important here from what I can see. Also, does your dad have an advanced care plan? Right? And I encourage you to get to your answers quicker. No sedation. We recently had his dosage of Keppra reduced because he has no seizures. Yes, he had CT, MRI, and LTM EEG done the first few days he was admitted. Okay, what did that show? Do you have access to the medical records? And does he have an advanced care plan? And even if he doesn't have an advanced care plan, have there ever been discussions between you and your dad about what he wants? If a situation like this ever came up, has there ever been a discussion? Yes, I had access to some records, but not all. No will or advanced care plan. Okay. Well, the first thing that I would do is get access to all of the medical records, right? And I presume that you are the power of attorney here. I presume you are the decision maker in the absence of your dad not being able to make decisions, right? I would also strongly recommend that you get a second opinion here, because clearly they don't want to hear from you that your dad is obeying commands. They don't want to hear that, do they? They want to create a narrative of your dad not making it, and they want to create a narrative of your dad not having any meaningful recovery. Now, if he can't wean off the ventilator, let's just say he can't wean off the ventilator, he will need a tracheostomy. That's when he will be able to start getting mobilized, right? And once you can start mobilizing him, slowly but surely, his brain function will probably even improve more. Now, also, I argue that with him being on the ventilator still with the breathing tube, he might need some level of sedation for him to be able to tolerate the breathing tube. Now, once he has a tracheostomy, you can pretty much stop all sedation. And then you can actually really see what his brain is doing. If I was you, I would would want you to look at the medications he's on, right? How can he tolerate a breathing tube for almost 4 weeks without needing sedation or opiates, right? I argue that he's still on sedatives or opiates right now. Otherwise, he couldn't tolerate the breathing tube. And once he's got a tracheostomy and he's off all sedatives and opiates, right, that's when hopefully his brain will completely come to light, and you can even see more of what brain function is there, right? Also, once tracheostomy is done, mobilization can be done, and he can be stimulated. And once again, you will see what's there and what isn't there, and you will see whether it's meaningful or not meaningful, but it already sounds to me like it's meaningful, right? Also, by them not doing a tracheostomy, that is medical negligence. That is medical negligence. Okay, you are saying ventilator settings, FiO2 has been at 40% for a while. He's breathing above the ventilator rate, working on getting his complete medical records to get his list of medications. Nurses refuse to give it. Doesn't matter whether they refuse it. You have the right. It's not a privilege, it's a right. It's a right for you to get access to the medical records, not a privilege. I assume you are the power of attorney. If you are not the power of attorney and someone else is the power of attorney, yes, then you won't have access, then you won't be able to get access to the medical records, but the power of attorney or next of kin will be able to get access to the medical records. Now, the other question you have to ask is, why can't you have access to the medical records? What is it they have to hide? What is it that you can't see? Also, so he's breathing above the ventilator rate. His FiO2 is set at 40%. So the question is, has he had any spontaneous breathing trials such as CPAP or pressure support? Right? Has he had that? But as far as I can see here, Alatham, it's, if your dad is obeying commands, there is a good chance for a meaningful recovery. And that's not up for them to judge. But I do believe you are dealing with a negligent medical team here if they don't want to do a tracheostomy, especially if he's obeying commands, because you can ask him himself, someone can explain to him what the options are once he has a tracheostomy, and then he can decide for himself what he wants, And I argue that if he's breathing above the ventilator rate and he's at 40% of oxygen, once he's gotten a tracheostomy, it'll be so much easier for him to be weaned off the ventilator, right? You're saying, I'm helping my mom to get conservatorship over my dad and his estate. We have a court hearing on July 23rd. His chart says daily spontaneous breathing trials, but another doctor wrote weaning not possible due to altered mental state. You absolutely need to get access to the medical records. Do you know what his Glasgow Coma Scale is? Do you know what I mean with the Glasgow Coma Scale? Now, I can tell you, if your dad is obeying commands and he's got a breathing tube, his Glasgow Coma Scale will be a minimum of 11. I can tell you that straight away. If you ask your dad to squeeze your hands, and he can squeeze your hands while you're asking him, if you ask your dad, Dad, can you wiggle your toes? And he's doing that. If you ask, Dad, poke out your tongue, and he's doing that, his brain is working. That means you can also ask him, hey, Dad, do you want a tracheostomy? Obviously, you need to explain to him what that means and what the options are. But the reality is that if he can obey commands, that is meaningful. And, they are potentially not being truthful to you. They've been trying to create a narrative of end of life right from the start, but you can see your dad is there. And you can probably also see that whoever did CPR at the time, you can probably also see that it must have been very effective. Otherwise, his brain wouldn't be there. Right? Also, the longer your dad stays in this condition without a tracheostomy or without the inability to be extubated, the bigger the chances of negative side effects such as muscle wastage, deep vein thrombosis, or PE, right? Contractions, pressure sores, the list goes on, right? That's why time is of the essence here. Time is of the essence here. I argue if your dad would have had a tracheostomy 2 weeks ago with the inability of coming off the ventilator, he might be off the ventilator now because, they could have started to mobilize him, could have started to communicate with him as well, much better with a tracheostomy, right? Like I said, I argue that they are negligent with the treatment they are withholding for your dad. Have you spoken to a neurologist? You're saying, yes, the doctors lie to us every day. They write on his chart that he has no corneal, cough, or gag reflex, but I check them every day. We don't know how to get them to do the tracheostomy. Okay. All right. So let me ask you this, Alatham. So your dad is opening eyes. When you talk to him, he's opening eyes. If you ask him, you know, Dad, can you squeeze my hands? Can you wiggle your toes? He's doing that. But if he's doing any of that, clearly there's a chance for recovery. And they are deliberately stopping any progress towards a recovery if they're not doing a tracheostomy. Right? That is the bottom line. Yes, a neurologist wrote in his chart that he would likely never wake up. Right. Okay. Have you spoken to that neurologist? Can you talk to your dad while the doctors are there so that they can see that your dad is responding? You know? And also, like I said, when they're saying he's likely never waking up, right? Is he still on sedatives or opiates because, you know, because of the breathing tube? Or do you think he's completely off sedation? But even so, how can you verify that without having access to the medical records, right? So it sounds to me like your dad is mismanaged here, severely mismanaged, and that they need to start doing all the right things as quickly as possible to help your dad go from A to B. One way for you to get them to move on a tracheostomy is make a formal complaint to hospital executive. That is one way for you to get things moving. That would be one of my recommendations here, because that is just not good enough. It is just not good enough from what I'm hearing here. Right. Okay. Now, if anyone on this call wants to talk to me directly, use the StreamYard link. Alatham, if you want to continue the conversation, it might be quicker if you get on the StreamYard link, or if you keep typing your questions into the chat pad. Alternatively, I will continue reading out questions here that have come in during the week or even earlier. I've got so many emails sitting in my email inbox. Now, you are saying the doctors do their rounds early in the morning before the visiting hours, so it's difficult for us to talk to them. I think they're keeping him sedated somehow and not telling us. Need complete MRIs. My goodness, that sounds horrible. Even for you, not being able to go to the to a ward round, once again, what sort of place, what sort of hospital is this? You know, because what is it they have to hide? What is it that you can't talk to them about? It sounds to me like your dad is in a prison. That's terrible. I'm absolutely shocked to hear what I'm saying, but you will need to escalate this to hospital executive. Hartford Hospital, where's in Connecticut? I believe we've had clients before at Hartford Hospital. I would need to look through all of my records. I believe we would have had clients before at Hartford Hospital in Connecticut. But anyway, you will need to escalate this to hospital executive, or at least to the medical director in this ICU. And once again, for you to be locked out even during ward rounds, that is just horrible. What I would also do if I was you is, you know, if your dad opens his eyes when you talk to him, if your dad squeezes your hands when you ask him to, or if he's wiggling his toes when you ask him to, if he's making any meaningful progress, you should put this on camera, you know, record a video with your phone so that you actually have evidence, right? Collect the evidence. I think that is really important here. Okay, now let's look at some questions that have come in, or questions or comments that have come in during the week. The first one is from Tracy, who says, "Hi Patrick, thank you for all your videos. A few years ago, the intensive care team did their best to pressurize me. I am glad I didn't give in. After 2 months with tracheostomy, my husband was slowly waking up. 12 months after, his vitals are stabilized, no jerks and no tremor. Currently, we are undergoing intensive physical therapy, physiotherapy, and speech therapy. Please never give up hope." From Tracy. Well, Tracy, thank you so much for writing in and for sharing that with our audience, because, you know, it's probably also what Latham needs to hear, you know, because Latham, you're in a difficult situation here, and, you know, with your dad, and you should never give up. And it doesn't sound like you will, but, you know, as you can see from those comments, there are other families out there who have been in similar situations and they had a very good outcome. So never give up. Okay. Another email from Doreen, who says, "Hi Patrick, my husband suffered a choking incident which led to cardiac arrest 2 years in June. He was on a ventilator. He went through the whole cooling procedure. They couldn't lower the medications for him to wake up because he was having seizures. The doctor in ICU basically told me the same thing you said. If he wakes up, he may not know who you are and the quality of life may not be good. We ended up transferring him to another hospital that had a continuous EEG because they didn't offer that where he was. He was transported, put on a continuous EEG, no seizure activity found. They took him off the ventilator and put in a tracheostomy. Started lowering the medications and sedation and opiates for him to wake up, and unfortunately, every time they started lowering the medications, he would start having severe myoclonic jerks. After messing around with medications, they were able to get the myoclonic jerks under control and were able to take him off the medications for him to start waking up. After a few days of him being off those medications, he wasn't waking up. I would be there every day playing music for him. When I would play certain songs that meant something to us, he would start crying. I told the doctors about this and they told me it was not intentional. It was part of the pseudo-bulbar reaction. I refused to believe this. When I played songs that meant absolutely nothing, there would be no reaction. Then it was meeting time. They pulled me into a room and basically told me that he's not waking up and I should start thinking of how are we going to move forward. Same thing, if he wakes up, his quality of life may not be good. Again, I refused to believe this. I asked the doctors, are his kidneys good? Is his heart good? They said, oh yes, all of his organs are good. I then said, to believe me, he is now in a facility, still has the tracheostomy, but he is awake, completely aware of everything that is being said to him, and he can respond. He will shake his head yes and no to respond. Still has all his memories. I'm so glad I didn't let the doctors pressure me into giving up on him. If I can give any advice to someone going through this horrible experience, you know your loved one better than any of the doctors caring for them. They can have their own medical opinion, but you know your loved one. Never give up hope. Well, thank you so much, Doreen, for sharing that once again with our audience here, because I think this is so important that, families hear these real life experiences, that there is hope. When there's life, there's hope, and your loved one best, and time can be the best healer. People often don't have the same quality of life than before, but yet, do they want to be dead or do they want to be alive? Well, the answer is often that people want to be alive. It's very simple. Life is sacred and we must preserve it. Right? So thank you, Doreen, once again for writing in. Now, Latham, I'm sure you've heard Doreen's comments here, and you must never give up. Never. So you are also saying here, Latham, that the doctors told me the same exact thing whenever my dad moved or cried. Well, you can think for yourself, and thankfully you are thinking for yourself. You are saying, I visited him in the hospital an hour ago and tears kept falling down his face when my little brother and I were talking to him at the bedside. Yeah. 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 So, they're negligent, Latham, and you will need to keep the pressure on. And we would be very happy to give you a second opinion and advocate for your dad, but we would need to have access to the medical records so we can write to them or talk to them directly, right? So that would be really, really important that we can do that. So I hope that explains to you to what I've been talking here about, and hopefully you can turn this situation around, right? Turn this situation around. And I'm sure you can. And I'm sure you can. Okay, so, Latham, do you have any other questions in regards to your dad? You know what to do. I think I've put you on the right direction here. And you know where we are if you want us to give you a formal second opinion by looking at the medical records, as a next step. Contact us at intensivecarehotline.com. Okay, let's move on to the next question. From Heidi, who says, Hi Patrick, I have a question. My mum is in kidney and in heart failure. She does dialysis 4 times a week. Yesterday she had a heart catheterization done and we were told that she needed open heart surgery. And now the doctors is saying that he's too scared to do the surgery. Also, she has no immune system to fight off any infections. Should I be scared what will happen without the surgery? Right. Okay, thank you, Heidi, for writing in. So, question is, why is she in heart failure? Right? Is that because she had a heart attack and she's got some blocked arteries? Is she in heart failure because she had a heart attack because of the blocked arteries? Is she having cardiomyopathy? Is she having a valve leak, a valve repair? Right? And why are they saying she has no immune system? Right? Why are they saying that? Okay. Now, it's hard for me to say without looking at the medical records why the cardiac surgeon would be too scared to operate on her. I can't, comment on that without having looked at the medical records and without having seen everything, that is going on. But if her heart is weak, then it can be risky for the surgeon to operate on her. With your comment that she has no immune systems to fight off any infections, what does that mean, right? And why is she immunocompromised, right? Why? Does she have low white cell count? Is she neutropenic? What does that exactly mean? They need to be more specific. It's probably not good enough to say she doesn't have any immune system without giving you any specifics, right? So just coming back, when she had the heart catheter, that means she probably had an angiogram. And like I said, what they normally do during an angiogram is they screen the coronary arteries, the arteries that supply the heart with oxygenated blood. And usually you can see in that angiogram that there might be a blockage. And then cardiac surgery is often done for the blockage. But once again, the question is, what's the blockage like? Can the blockage be undone by putting a stent in, a PTCA? right? Have you considered that? Do you know what to look for? Do you know what questions to ask? Because those are the options. If the coronary arteries are blocked, you can replace those blocked arteries by doing cardiac surgery. You can dilate the arteries during the angiogram, or you can put in a stent or a PTCA to unblock them completely, right? So why has that not been done? If the coronary arteries are blocked, why is your mum not having surgery, right? Is she having cardiomyopathy? Is she having a valve leak? Does she need a valve replacement or a valve repair, right? Those are the questions that we'll need to ask. And you're asking what will happen without the surgery. I don't know, because I don't know why she does need surgery. I need the reason why, right? So I hope that helps you, Heidi, and answers your question here. But again, we often need access to the medical records to really drill down and answer your questions. Otherwise, the devil is in the detail in situation like that. The devil is in the detail. Okay, Alathim, you're saying, I'll send you his complete medical records once we get them. We need the judge to grant my mom conservatorship first. Hospital won't release records unless she has legal authority. Yep, that can be part of it. That can be part of it, but you need to speed up. You need to speed up the process here, really, to get this done as quickly as possible, because time is of the essence here. You don't have a lot of time, because every day your dad is sedated potentially and having the breathing tube. That can cause significant side effects such as deconditioning. He would already be deconditioned every day, where he won't have the tracheostomy. The deconditioning will get worse, and then the recovery will take even longer. They've wasted so much time already. They've been extremely negligent here. Extremely negligent. And if I was you, I would write to hospital executive as quickly as possible. So it's something we can do. We write on your behalf. We help you craft emails, to hospital executive that work, right? And we can do the same for you. Now, once you have the complete medical records, send them to us. Send them to support@intensivecarehotline.com. And then I will give you a quote, how much it costs for the review. Okay, so let's move along to the next question or the next comment from Mindy. Mindy says, "Hi Patrick, my mom had all the odds against her. She had severe COPD and emphysema, uncontrolled diabetes, undiagnosed sleep apnea, history of heart disease as a child, and then she got COVID when the Delta variant was out in July 21. All she had was a runny nose and watery eyes for the first 2 days. She got tested just to make sure she didn't have COVID. She had only left the house 2 times in 2 years. And she was working from home due to her being high risk. She ended up going into acute respiratory distress syndrome, also known as ARDS, and my dad called 911. She was taken to the ER 2 minutes away from her house and one of the best hospitals, where she went into cardiac arrest. I'm assuming due to pulmonary hypertension and her severe double COVID pneumonia. She was very hypoxic and hypercapnic. Hypercapnic means she had CO2 retention. The doctor tried to tell us she wouldn't make it, even stating that even if they got her heartbeat back, she would not recover, that she was just too sick. She was maxed out on vasopressors and I believe even on ECMO at some point. She was intubated as well. 2 days later, she was weaned off. Due to some other hospital-related issues, she had a longer stay, but long story short, she made it and is still here today. She is now in ICU again after being in LTAC and now being neglected. She's recovering again. Hopefully she pulls through and all goes good this time around, from Mindy. Mindy, thank you so much for sharing this once again. This is such a good survivor story, and people need to hear that, because what they hear on the other end is people dying and not surviving. And the reality is, if you know what questions to ask, if you know your rights, if you stand your ground, things will change for you. Keep in mind that approximately 90% of intensive care patients survive, right? With 90% of intensive care patients approximately surviving, the odds are in your loved one's favor. Now, that's not what intensive care teams are telling you. They're telling you, like in a Latham situation today, that your dad is dying and there won't be any meaningful recovery. If he does survive, well, you should never give up. You should never give up, and you should, keep going. I want to read out this email from Heidi again, because I think it's so compelling. And I think it's so, not from Heidi, from Mindy, because I think this is what families need to hear. Because otherwise, all they hear is the doom and gloom from doctors and nurses in intensive care. So let me read out this email again. Hi, Patrick. My mom had all the odds against her. She had severe COPD and emphysema, uncontrolled diabetes, undiagnosed sleep apnea, history of heart disease as a child, and then got COVID when the Delta variant was out in July 21. All she had was a runny nose and watery eyes for the first 2 days. She got tested just to make sure she didn't have COVID. She had only left the house 2 times in 2 years, and she was working from home due to her being high risk. She ended up going into acute respiratory distress syndrome, ARDS, and my dad called 911. She was taken to the ER 2 minutes away from her house, and one of the best hospitals, where she went into cardiac arrest, I'm assuming due to pulmonary hypertension and her severe double COVID pneumonia, and she was very hypoxic and hypercapnic. The doctor tried to tell us she wouldn't make it, even stating that even if they got her heart back, she wouldn't recover, that she was just too sick. She was maxed out on vasopressors and I believe even on ECMO at some point. She was intubated as well. 2 days later, she was weaned off. Due to some other hospital-related issues, she had a longer stay, but long story short, she made it and is still here today. She's in ICU now again after being in LTAC and being neglected. She's recovering again. Hopefully she pulls through and all goes good this time around. Latham, I've got you here now. Can you hear me okay?
Hi, Patrick.
Hi, Latham. How are you?
I'm good. How are you?
Very
Sorry,
good.
I was in the car when the live stream started, so I couldn't really talk. But I'm back home now.
Well, I hope you weren't typing all of this while you were driving.
Oh, I had it typed out earlier. I was like ready.
Right.
Live stream.
I see. So look, I think with what you've shared with me, your dad's brain seems to be there. That's certainly what your impression is. Is that correct?
Yeah, I mean, some days he doesn't has his eyes open, but I know he's listening to us because he'll cry and he'll still move and stuff. Today his eyes weren't open, but I held open his eyelids and he was moving his eyes towards me and my mom because she was working out his legs.
Right. Well, and again, I am questioning here if he's not opening on his eyes on some days, but he's opening his eyes on other days. I argue he might still be sedated with something.
Right.
Right. Here is another thing. So he still has the breathing tube in his mouth.
Yes.
The longer that stays in, there's also damage that can be done to the vocal cords. They need to change him to a tracheostomy. I'm so shocked.
We've been pushing for it, but the doctors are refusing to do it. They're saying he doesn't have any brain function, or that it's too high risk or something. I don't know.
There's plenty of patients that end up with a tracheostomy that have no brain function. Plenty. or limited brain function. Do you think your dad is at a point where you could ask him what he wants?
I don't think he can verbally respond just yet, especially because he's still intubated. I could try asking him to move his feet or to blink his eyes if he wants it.
Right. If you think he can talk yes and no questions, then you can ask him, explain to him what is a tracheostomy, what are the pros, what are the cons, and ask him what he wants. I mean, it sounds to me like he is in a good position to, to tell you what he wants. Or do you think that's too much?
I could give it a try. It can't hurt.
Can't
'Cause
hurt.
I want to make sure we're doing what he wants.
Yeah.
But
Do you
I
know?
don't think he wants to die, that's for sure.
Do you know what his Glasgow Coma scale is?
I can pull up his chart right now.
Okay.
I have access to some of his records, but not everything that they're posting.
Right. Okay.
Oh, okay. They're not writing the GCS in his charts.
Right.
They're using something else. Richmond agitation sedation scale.
Sure. What's that? That's the RAS score. What's that?
They wrote it as -4.
Oh, he must be. And this is in the last. From when? This is in the last few days.
Yes, this is from his progress notes for today.
Okay. Well, there's two things then. If the RAS is -4, there's two things. The first thing would be he's either sedated or he is not waking up and he might not be sedated, but that would be a misjudgment given that when you talk to him, you're getting responses. Because a RAS -4 basically means he's not responding. He's not responding. But you are saying he is responding.
I think it depends on who's talking to him, because when it's someone he knows, he'll move around, he'll open his eyes and stuff. But when it's the nurses or the doctors trying to do their evaluation, he doesn't do anything.
Right. But you are not there when the doctors or nurses are doing their evaluations.
Right. Yeah, they're writing in his chart that he's not on any sedation, but they've had him on the ventilator for so long.
Right.
So if they're really not sedating him, that must be torture.
Must be torture. Now, having said that, a RAS of -4 suggests that he is either sedated or that he isn't waking up despite not being sedated. But that's why it's so important for you to get access to the medical records.
Yeah, we're working on it.
Right.
My mom asked for a list of the medications they're giving him, and a nurse refused her. So
Nurse refused.
You got to go through the court.
Have you considered getting him to another hospital?
Yes, we've considered it, but my mom said they probably won't do the transfer because he's still on the ventilator.
They can transfer him on a ventilator. They can. That's not going to stop them.
All right. Well, it's a matter of finding a hospital that will take him.
Is there a hospital in your area that would take him? Any ideas?
We haven't asked any hospitals yet. There is one, St. Francis Hospital, but they recently were taking out of this insurance network.
Right, okay. But you absolutely need to put the pressure on here. This is ridiculous.
I know.
You know,
it's
even,
really hard on my mom.
I can imagine. And even if your dad, let's just say he's not waking up, right? You don't know that yet, and you still want to give him a chance. There's plenty of time to talk about end of life. Plenty of time. What's the urgency to potentially kill your dad?
For them, I think it's all about money.
Oh, of course. It's all about money for them. But irregardless, if I was you, I would write to hospital executive as quickly as possible that you're not happy. I would make a formal complaint if I was you. I would make a formal complaint because you don't have a lot of time here and things need to change pretty quickly.
Yeah.
You almost have nothing to lose by doing so because they're not doing the right things there.
I'm still trying to figure out why they never did the TTM. We asked the doctor over the phone, but he said to ask cardiology because he was with neurology, and we found out who the cardiologist was, and we opened up the report on his chart, and I don't think he was even there when they were evaluating my dad.
Right.
The report came in the next day, but when you do TTM, it needs to be started as soon as possible.
Needs to be started immediately.
Yeah. I don't know what's going on there.
Yeah. Have you or your mom given consent to any procedures?
We've given our verbal consent and written consent to any procedures needed to treat him.
You see, you could, the question is, how can you give consent to something where you don't have access to the medical records? Like, on the one hand, they want you to give consent, but they're not transparent.
Right.
That's how I would approach it with them as well. How can you give consent without having full access to medical records, full transparency? Because, you also, let's just say they ask you for more consent for other procedures. And, you may want to seek a second opinion first, but you can only seek that second opinion if you have access to the medical records.
Mm-hmm. Yeah, they're being very secretive about it.
Sounds like it.
I think from the very start they never wanted to treat him.
Right. Now you gotta kick a fight there. Unfortunately, you gotta kick a fight. That's the only way that I can see this moving forward with what you've shared with me.
I need to look up who the hospital executive is.
Yeah, I would do that. Usually you will find that on their website. And it's not difficult in this day and age to find their email address. It's not difficult. All right, Latham, we're coming close to the hour mark here. I need to wrap this up. Any final questions before I let you go?
Oh no, that'll be all. Thank you so much.
It's a great pleasure. I wish you all the best. You know where we are if you need more help.
Yeah, I'll keep you updated.
Okay. All the best to you and your family. Thank you so much.
Thank you.
Thank you. All right. If you need help, we have a membership for families of critically ill patients in intensive care. And you can become a member at intensivecarehotline.com by clicking on the membership link. And I also do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, Skype, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly. I handhold you through this once-in-a-lifetime situation that you can't afford to get wrong. When I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care. We also do medical record reviews in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel here for regular updates for families in intensive care and intensive care at home. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. You can also leave a small donation here on the Super Chat YouTube button so we can make as many videos for families in intensive care and intensive care at home as possible. With intensive care at home, we are currently operating all around Australia, sending our intensive care nurses into the home. We're operating in all regional and rural areas, all major metropolitan areas. Really, location is not a limitation for us. We are NDIS approved in Australia, iCare in New South Wales, TAC and WorkSafe in Victoria, NIISQ in Queensland, DVA, Department of Veteran Affairs, all around the country. Like I said, with intensive care at home, we are providing a genuine alternative to a long-term in intensive care at home. And our home care services include long-term ventilation, tracheostomy care without ventilation, BiPAP, CPAP without tracheostomy, home TPN, home IV potassium infusions, palliative care, weaning at home, port management, PICC line management, central line management, as well as port management at home. We're also providing level 2 and level 3 NDIS support coordination, and you can reach out to us if you're an NDIS support coordinator. Reach out to us if you need nursing care for your participants. If you're at home already and you need intensive care at home, please reach out to us as well. Don't worry about funding. We can help you about funding. We have been involved in the advocacy for funding from day one for our clients, and we can help you with funding as well. Now, and if you are a critical care nurse and you're looking for work for intensive care at home, we currently have jobs in Sydney, Melbourne, Brisbane, Albury, Wodonga, Bendigo, Warragul area. We need a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care nursing qualification. And if you're an intensive care specialist watching this, we also want to hear from you. We are currently expanding our medical team for intensive care at home. And if you're an intensive care specialist watching this and you have bed blocks in your ICU, we can help you eliminate your bed blocks in ICU, and you won't even pay for it. And if you're a hospital executive watching this, we can also help you eliminate your bed blocks in your hospital's ICU, ED, respiratory wards, all of that, and again, help you to keep help you free up ICU beds, ED beds, respiratory ward beds. Now, thank you so much for watching, everyone. Once again, I do another YouTube live next week around the same time. Once again, subscribe to my YouTube channel, click the like button, click the notification bell, share the video with your friends and families, and leave your comments what you want to see next, what are the topics you want me to cover. Have a wonderful weekend, everyone, and thank you so much.